reason I chose the specialty of endocrinology is that I have a strong family history of diabetes and thyroid disorder. Type 1 diabetes is when your pancreas doesn't make any insulin, and type 2 diabetes is when your body is resistant to the insulin that your pancreas does make. The insulin pump is a small device that you wear, and it replaces your multiple daily injections, and it also mimics what a healthy pancreas should do. Some of the benefits of having an insulin pump is that when you eat, depending on how many carbohydrates you eat, your pancreas should be giving you a certain amount of insulin for the carbohydrates you're eating. But when you do multiple daily injections, you're only taking a certain amount of insulin for what you're eating. So you tend to have high blood sugars or low blood sugars because you're not treating what you're eating. With the insulin pump, you're actually treating what you're eating because you're putting in the correct amount of carbohydrates, so you're getting the correct amount of insulin. This helps to prevent hypoglycemia, which is low blood sugar, and hyperglycemia, which is high blood sugar. The advice that I can offer patients struggling with blood sugar control is to find a good endocrinologist or nurse practitioner or physician's assistant. We offer one-on-one counseling for diabetes with either the endocrinologist or the nurse practitioners. We offer diabetic education classes several times per month that are free to patients, and we also can refer patients out for diabetic education. I think that the more patients understand their disease, the more they're able to manage it.
Well, given my educational background and experience in clinical nutrition therapy, I've developed a great interest in working and learning more about diabetes and weight loss management. I've also developed a great appreciation for the role of hormones and the major role they play in balancing our body function and physiology on a daily basis. The most common misconception regarding weight loss from a nutrition or medical standpoint is that a lot of patients, I feel, they're still in the search, or they still believe that there is a magical way or magical potion out there to help them lose weight in the fastest way possible and in a significant amount with minimal efforts. And that's evidenced by the popularity of many of the fad diets that have come and gone over the years. But the reality is fad diets don't work, and quicker is not better, and it's not the healthy way to go. A lot of the fad diets, they carry a lot of health concerns, and they raise a lot of red flags, actually. And in the end, it's actually the classic formula of we need to modify our diet and our exercise and activity, and it has to go down to less calorie intake and more calorie expense in the form of activity. My advice to these patients who are struggling with weight loss is first, like any problem you're looking at, you need to begin with assessment. So you need to assess, first of all, your whole lifestyle and your dietary and exercise habits. You need to look into areas where you could find some behaviors that you can change. Second, I need to advise them to evaluate their goals, if they have any goals, and to see if these goals, are they specific, are they vague, because someone could say, I need to lose 50 to 100 pounds, and that can look so overwhelming and so discouraging. What I would advise them to do is break this goal into small, measurable, more specific goals. So I will transform that into let's lose 1 to 2 pounds a week over the next 3 to 6 months. So that makes it more achievable, more specific, more realistic, and that's how goals need to be. The goals also need to be measurable, because this is how we will be able to track our progress, decide whether we reached our goal or not, and if not, we need to go back and reassess and redefine our plan and find a way to make that happen. I would also advise them to celebrate even the small achievements. Don't wait for the 50 pounds so that you can feel more encouraged and motivated. Celebrate your small successes and build on them. And that's the way to help you continue on this journey of healthy weight loss and healthy life.
Before I became a nurse practitioner, I worked as a nurse in a dialysis center, and I saw every day the effects of bad blood sugar control. It was at that point in my career that I became committed to helping people better control their blood sugars, and that's been my passion now for about 20 years. The thyroid is a very important gland that has a major role in regulating many body functions by producing and releasing thyroid hormone into the blood. Someone with hyperthyroidism or overproduction of thyroid hormone may feel jittery, nervous, may feel their heart pounding in their chest. They may have some difficulty sleeping. They may have some diarrhea and may feel warmer and sweatier than people around them. People with hypothyroidism or underproduction of thyroid hormone may feel colder than those around them. They may have some brain fog. They may complain of concentration difficulties. Their hair may fall out. They may complain of dry skin, brittle nails, may have some constipation. Treatment of hypothyroidism is actually quite easy. You just take a pill every day to replace the thyroid hormone that your body's not producing. Treatment of hyperthyroidism may involve just taking a pill every day, but some people might need a radioactive iodine therapy treatment, or they may actually need surgery to quiet the gland. Thyroid disease is actually quite common. About 30 million Americans suffer from some sort of thyroid disorder. Women are 10 times more likely than men to be affected, and a woman over the age of 35 has about a 30% chance of having a thyroid disorder.
I've been practicing endocrinology for 20 years. An endocrinologist is a doctor who is specialized in treating problems from endocrine glands, which are glands that are in your body that produces hormones. And these hormones are like chemical messengers from one organ to another. But when there is a problem with them, you could have something like diabetes, problems with thinning of the bones like osteoporosis, or say menopause from the female hormone problems. So a hormone, as I just mentioned, is that it is a chemical messenger that goes from one organ to another to affect that organ, make the organ say work harder or slower. So for example, thyroid, which is a gland in your neck, produces a thyroid hormone, and that makes the chemical reactions in most of your body works faster. Endocrine, endo means internal and crane means secreting. So it's an organ that secretes internally, meaning into the blood, and not rather than into a hollow viscous, like say a bowel or something like that. So it goes directly into the blood and get distributed to all the rest of the body, and leads to some effects that way.